Kelsey, you're muted on my screen.
Hi, yep, that's correct. We're just waiting for people to join. We're gonna wait for like one more minute. And then we'll go ahead and get started. If I could please ask anybody or everyone to put themselves on mute so we don't have any background noise. Um, and actually, it's just 10:01 on the dot. We have a lot of information to go through, so I'm gonna go ahead and give it to Haley, and we're gonna get started with our training. Welcome everybody.
All right. Okay. Thank you guys for joining today, and we welcome you to our training, ABE 101, completing a Medicaid application. All right, so to introduce myself, my name is Haley. I am the Community Engagement and Benefit Access Specialist here at Age Options. And then joining me today is Kelsey Gordon. She is the Advisory Training Specialist as well as a Benefit Specialist. All right, so what is a BEC? So me and Kelsey work for the BEC department. So we are a benefit enrollment center, meaning that we assist older adults with completing applications and understanding their benefits. We also conduct outreach and provide support to other counselors in our aging network like you all. Okay, a bit of housekeeping. Please be sure to stay on mute while we're presenting. And then any questions that you have throughout the training, please submit it in the chat. And then Stella is here. She will be answering those questions. Okay, so the purpose of this training is that we want to provide new benefit counselors an introduction to the ABE website and the Medicaid application. As benefit counselors ourselves, we wanted to create a training that's more focused on practice than policy, and to create something that we wish that we had when we first started taking applications. So the main goals would be for you to learn introductory instruction on how to complete an ABE application, learn what specific language to use, and to get an idea of what the Illinois Medicaid system looks like. Okay, so today we will be discussing a Medicaid overview, the Medicaid enrollment process, and then we'll be taking you step by step through the ABE application. And then we will introduce how to submit documents, as well as give you a look at what management case account can do for you, including submitting redeterminations. And then we'll give you a few troubleshooting tips. All right.
Hi everybody. Really quickly, can I just confirm from you, Haley, that you all can hear me? All right, my microphone is working. Welcome. So I'm Kelsey, and I'm gonna.
Okay.
Get...
It could be the laptop.
Okay. All right, sorry, we had a little bit of sound difficulties, but I think we're good. So my name is Kelsey, and I'm going to begin by sort of introducing us to sort of the basics of Medicaid. And so number one, what is Medicaid? Medicaid is a health insurance program. It is all over the country, in each individual state, and it is for people with low incomes. The funding for Medicaid comes from the federal government and the state government. All right, now, what is Medicare? Medicare is a different federal health coverage program, and it is very commonly confused with Medicaid. So right off the bat, we want to clear up the differences between these two. So Medicare is a federal health coverage program for older adults who are 65 and older, and for some people with disabilities who have a qualifying work history. So some people have Medicare and Medicaid. And if someone has both, they are typically referred to as a dual, and that is because they are dually eligible for both programs. Now, right here, you can see the Medicare card. It is the red, white, and blue card. It's a way that people often think about it. And that's kind of a good way to help people differentiate between Medicare and Medicaid, that Medicare has a red, white, and blue card. Now, as I mentioned earlier, Medicaid is run by both the federal government and the state government, and states can specify how they would like to administer their Medicaid. And so consequently, all states have minimum coverage requirements, but they can expand the coverage in many ways. And what happens is every single state has a very different set of rules. No two states have no two Medicaids are the same. So Indiana Medicaid is very different from Illinois Medicaid. And Illinois, we manage multiple different Medicaid programs for different populations of people. And each of these programs have different income limits and different rules. And so the reason why this program can get so complicated relates to the fact that there's so many different programs. If you look right here, I put this image of these nesting dolls. And that's because the more you learn about it, the more you come to realize that's kind of how Medicaid works. You kind of have programs within programs within programs. So the first thing to sort of understand is that is how Medicaid is structured. We've got this main program and then different rules for people of different populations. So here's a list of all of the different Illinois Medicaid programs, just to give you all an idea of how expansive the program is and how many different things there are in Illinois. These ones in yellow are the most common that a beginning Medicaid counselor will encounter, and they're the ones that we're going to be focusing on today. There is ACA Adult Medicaid, which stands for the Affordable Care Act Medicaid, relating to the Medicaid that was expanded from the Affordable Care Act. And that is Medicaid available to adults aged 18 to 64 who do not have Medicare. And then there's AABD Medicaid, which stands for like Aid to Age Blind and Disabled. And that is for adults over 65 and people with disabilities. A subset program that you may encounter, we do not have time to go into it today, but I want to note it, is a spend down, AABD spend down Medicaid. And that is a program that can allow adults over 65 and people with disabilities who are over the AABD income limit and asset limit to still enroll in Medicaid. And then finally, we did highlight here in green home and community-based service waiver programs. We will not be going into these in detail, but it's still very important to know that they exist. And so with that in mind, we have a slide that's going to go into this in a little more detail. Home and community-based waiver services are Medicaid programs that are designed to offer long-term services and supports to people in their homes. Caretaking is the most common home and community-based waiver service, but it is not the only service that is offered. What's important to know is there are multiple different HCBS waiver programs, and each one has different rules and regulations for someone to get those services. They do all require something called a DON, or a determination of need, which is a screening that shows that the applicant is at risk of placement in a nursing facility. So we made a chart here of all of the different HCBS waiver programs so you can get an idea of what they are. This chart is included in your template, or sorry, excuse me, in your toolkit for reference. I think the most important thing to note about it is we have this column here that has the first point of entry, and that is, referring to if you want to help someone get enrolled in this program, the first place to go to begin the process of enrolling is these these different government agencies. It is worth noting that if you do need to refer someone, there will likely be additional steps and they may need to further refer them to another party. But the first point of entry to enroll in these programs is is listed in this column right here. More information about waiver programs is available online, and we did include the link available for you if anyone is interested further.
All right, so to discuss the key government stakeholders, at the top we have HFS, or Health and Family Services. And as it states, they are the state government body making policy decisions. Beneath them, you have IDHS, or Illinois Department of Human Services. So they are the agency you will be referring to the most. DHS administers the Medicaid program, which means that you will submit applications to DHS to process, and people within DHS will be making the decisions on the cases. Under the DHS umbrella are the FCRCs. So these are the physical locations where applications are sent and processed. They are often referred to as the local public aid office because they have many locations across the state, and cases are assigned based on proximity to these offices. Within the FCRC is the local office administrator, or LOA, and caseworkers serve under the LOA. They sort of operate as the office managers, and then caseworkers are the ones responsible for approving and denying the applications. Then here's a visual of how many FCRCs we have in our area. Okay. And so eligibility, all Medicaid programs are means tested, meaning that you must meet a certain income limit to qualify. Other eligibility factors for Medicaid is immigration status, household size, and assets. Eligibility amounts are based on the federal poverty line, or FPL. And to note, these numbers change annually, typically around April. Okay, so some more detail regarding the immigration status. So you would have to be a legal permanent resident and live in the U.S. for 5 or more years, or be a non-citizen in one of these groups. We do have a more comprehensive list in your toolkit. Okay, and then here's the programs available to non-citizens. First, we have HBIA, or Health Benefits for Immigrant Adults. These are for adults aged 42 to 64. And then HBIS, or Health Benefits for Immigrant Seniors. And then this is coverage for adults 65 plus. And then these programs are available regardless of immigration status. However, currently enrollments are paused. We also have emergency coverage for non-citizens for people who do not meet these immigration eligibility requirements as well. Okay, and then here's a quick explanation of gross versus net income. So all income reported must be gross income. So gross income is the income you receive before deductions, whereas net income is income you receive after deductions. So if someone is working, you would need their income before taxes are taken out. And then if someone is receiving Social Security benefits and has Part B premiums taken out, you would refer to the amount earned before the deductions. Okay, and then here is a table showing you each of the income and asset limits for these main 2 Medicaid programs. The table is included in your toolkit for you to refer to later, but the most important takeaway is that ACA is available to people without Medicare. So this means that if you are aged 18 to 64 without Medicare, you can enroll in ACA Adult Medicaid. If you are over the age of 65 or disabled, you may receive AABD Medicaid. It's important to note that ACA has a higher income limit than AABD, and it does not have an asset limit. So to be eligible for ACA, you can have a higher income and unlimited assets. But to qualify for AABD, you have to meet a lower income limit and have assets under $17,500. Okay, and then here's a little visual we have of the Medicaid enrollment process. So first, you would complete and submit the application. Next, you would upload the client's documents. Third, you would wait and receive the decision from DHS. And then after they have been eligible and receiving Medicaid for a year, you would complete a redetermination to renew their coverage.
All right, so with that in mind, we're now going to walk you through how to complete an ABE application, which is the online Medicaid application. So this is everything that we're going to cover in this section. It's going to, we're going to review how to create an account and then how to complete the general information section, identity proofing, health coverage, disability, and unpaid medical bills, which is a section on the application, the asset section, how to report assets, how to report income, some suggestions on how to handle the additional information section, submission, and finally uploading documents. All right, so first things first, let's review what ABE is. So ABE stands for the Application for Benefits Eligibility. It is also conveniently like Abe Lincoln, you know, because we're land of Lincoln. And you can see a picture of Lincoln's face on the website too, so that was intentional. But regardless, it is the state of Illinois' official platform where individuals can submit applications or get the status of their cases for these public benefits in the orange box. So you can apply for Medicaid, SNAP, TANF, or AABD cash, which is a cash benefit available for people with low incomes. I did not explain what SNAP is. I'm going to go back. That SNAP is food stamps. It's also called EEBT or LINK in Illinois. And then you can also apply for a Medicare savings programs. Medicare savings programs, there are 3 different benefit programs that will pay Medicare Part B premiums. And one Medicare savings program, the Qualified Medicare Beneficiary, or referred to as the QMB, also pays Medicare Part A premiums and Medicare cost sharing. One thing to note, we do not train on AABD cash or TANF, although we do assist people with all of these other different benefits that you can complete on ABE. So what are the benefits to the ABE application? There's a bunch, namely that it is much easier to track these applications because there is a record of everything. You can also submit an application for Medicaid by fax or mail, but if you do, it will run the risk of getting lost. And you can also apply in person. However, there's no record of what was listed on that application when it is submitted in person. Additionally, the platform, it has a secure way to upload documents. So for all of these reasons, we strongly recommend that you encourage people to use ABE as much as possible. And we really recommend that people only utilize paper applications as a last resort, again, because they can be much harder to track and they do run risk of getting lost. So as a counselor, or a Medicaid counselor, the first thing you always want to begin with an application is an intake. And, Haley and I sat down and kind of collected a list of information that we would recommend that you include on an intake. So before you have someone come in to do an application, we recommend that you get the following information from them. You do need to know if you are including an application for an additional benefit, you will need additional information. But for Medicaid, you'll need proof of identity. That would be found on a driver's license or state ID, full names and date of birth for everyone on the application, Social Security numbers for everyone who is applying for benefits. If there is someone in the household who is not applying for benefits, you do not need their Social Security number, although you would need to list them on the application. You'll need the alien registration number for anyone who is applying and who is not a U.S. citizen. Information about the gross monthly income for everyone on the application. Information about health insurance through work, if applicable. The value of everyone's cash, checking, savings, or other bank account, like their liquid assets. And then you'll need to get some general information about vehicles, property, or life insurance for everyone in the household, but nothing terribly specific for most cases. And we'll get into that later. And then if you are applying for a Medicaid spend down, if you're familiar with that program and know a little bit about it, you want to do it, you're going to also need to get copies of medical bills from the past 6 months. All right, so here's the home screen for ABE, and we have the website in big blue letters right here. It is www.abe.illinois.gov. All right, and when you go here, this is the first thing that you're going to see. We want to draw your attention to these 3 big buttons on the bottom because they sort of lead you to the 3 main components of the application. The first thing you hear is you have a benefit screener if you click this button. And this is very useful, especially for beginning counselors. If you need to figure out what people may or may not qualify for, you can go ahead and do this benefit screener. It's very helpful because determining eligibility can get confusing. In the middle, we have this apply for benefits button. This is a link to apply for a program for someone who does not have an open case with the Department of Human Services, meaning they do not have SNAP, they do not have a Medicare savings program, they do not have Medicaid or ABD cash. It's their first time, enrolling in a program through this office. And then here in green is the Manage My Case button. That Manage My Case is the name they have for a portal that allows you to view the status of any existing benefit case that someone might already have. You can also add new programs onto an existing case. For example, if someone has SNAP and you want to get them Medicaid, you can add a Medicaid application onto that existing SNAP case. You can file redeterminations and you can report changes. So if somebody already has a benefit, instead of clicking apply for benefits, you're going to want to click manage my case so you can add a new benefit onto the existing case in the system. All right. So next I'm going to walk through what happens when you click this middle button, which is what it'll look like if you're helping someone apply for something for the first time. So you click this, and then you're going to need to create an account. Okay, so you click that button, click next, and then it'll take you to this page. And this is pretty simple. You just need to sort of set up a user ID and password. But what we sort of recommend as a best practice for creating that username and password with the client is to develop a formula within your agency. So we have an example formula. It is not the one that we use here, but it just to exemplify what we mean. Which is for the username, you could do the last name of the person and the year they were born, and then the password could be their street name, their phone number, and an exclamation point. While we recommend you share the client's username and password with them, for security purposes, it is important that you never share the agency's formula, because we don't want that information going into the wrong hands where, someone realizes that if they just know the street name and phone number of someone, they have their password. So just make sure to keep the formula confidential within your agency. After you create an account, you will have some security questions. Make sure to give these to the clients and save a record of them because they are going to need them. The security system does require that the password get changed every 180 days. And when they do that, they're going to need the answer to these questions. Also, if the client ever forgets their password, they will need these security questions. The question answers must be more than 4 letters. It's just a tip that we sort of learned from experience. That's good to note. All right, so then once you have created the account, you're going to click the login button, which is in the upper right-hand corner in green of the homepage, and you're going to log in. We created a fictional account for someone that we named Johnny Appleseed. So for the rest, we're going to kind of see Johnny Appleseed's journey through an ABE application. The first thing you'll see is this screen right here, you want to click private computer unless you are in a public place. If you click public computer, the application will time out, and so private will make it much easier for you. All right, once we do that, it will show you this screen right here. All right, if it is a new application, you're going to click Start a New Application. And again, I have a note here that if there is an active case, you don't want to be starting a new application. You would actually you could click keep working on an application, or excuse me, check the status or view an application you've already submitted, which was another way to access the Manage My Case, similar to the button I showed you in the beginning. But for a new application, you'll click this top button, and then it will take you to this screen, just giving sort of some general information about sort of the ABE process. It's not terribly important. You could just sort of scroll through this and click next. And then it'll take you to this first question. So it's going to first ask who's filling out the application. You're going to say that you're a staff person of a community agency. Now, some of your organizations may have registered as a community agency, in which case you could put your number here. If you haven't, you can just leave this blank and continue forward. One thing to note is some agencies may have rules about whether or not you want to become an approved representative. So just make sure to check in with your agency if you need to become one. An approved representative is someone who can officially make case decisions on the case. And yeah, again, like certain places have different policies where that's required. So we're just making a note of that. Okay, once you've done that, you're going to see this screen right here where it will ask you to pick which programs you're applying for. So for Medicaid, you're going to click apply for health coverage. If you want to attach an application for another benefit on here, you can. Otherwise, you will have to click no and say that you are not applying for any of the other programs. And then, yes, if you do have clients apply for other programs, there will be additional steps and documentation required. All right. So after you've selected which benefit you want, you're just going to go ahead and click next. And you're going to see the general, we're going to get led to the general information section. So first page is pretty simple. We're going to list the person's name, gender, birthday, marital status, and the county they live in. And then we're going to go ahead and list their address. It is important to note that a mailing address can be different from where someone lives. If you are working with someone who is homeless, you can list a mailing address here. You do need to have a mailing address though for this application. And the reason for that is that pretty much all correspondence from the Department of Human Service is coming, it's communicated through paper mail. There are a lot of different places that somebody who is homeless could use as a mailing address, different like community shelters, places like that, offer that service. Okay, once we're done with that, you're going to list contact information. You're going to put in the person's phone number. We recommend that the person elect for text reminders. Those reminders will be for things like redeterminations, other like important sort of dates that they might need to be aware of. They can also elect to get emails. The emails will just alert people that they have a notice that's been uploaded to their Manage My Case. It will not email the person the notice. So if they sign up for this, they will need to log into the Manage My Case to see what the notice is. All right. And then after that, we have this question here where it asks about the people in the home. This is asking about the number of people in the household, and that can be important because it relates to eligibility. There is a higher income limit for a household with 2 people in it than a household with 1. And a higher limit for, the larger the household, the higher the income limit. And so the number of people that you list on this application is going to be affecting how they're going to determine whether or not you qualify. So it is it feels simple, but it's important to think about. We recommend, it's particularly if you're working with a larger family, really pause and read through this and think about how that family situation applies to this description. It can get confusing. And so I do want to point out, we did include a really, really wonderful chart that was, that we found. And it is a flow chart that will help you determine who to list on a Medicaid application when there's a larger household. It can get, particularly confusing sometimes if someone is filing taxes or not filing taxes. Just save that chart. It is so helpful. When in doubt, you can go ahead and refer to it to figure out exactly who you're gonna list on this application. All right. So, you're gonna say how many people are in the home, and then it's gonna take you to this section right here. So we're going to confirm we do want to apply for health coverage. And then we have an opportunity to request backdated coverage. So that is something that is available for Medicaid. It is only available if you request it here. So make sure if the person needs backdated coverage to help pay for unpaid bills, that you're requesting it here. If you request backdated coverage, they will be asking questions to confirm that the person is eligible for Medicaid during any of these previous months. So you will, we'll go through them, but you'll see that you'll get questions sort of related to eligibility for December and November. And then once you've selected if you want backdated coverage or not, it's going to ask you which Medicaid program you'd like the person to enroll in. You can select if they would you'd like them to, apply for AABD Medicaid, ACA Medicaid, or you can select no preference. If you click no preference, then they will get screened for ACA Medicaid because there are simpler eligibility rules. There's a higher income limit and there is a no asset test. So we wanted to take a moment to pause and think about, the difference between ACA and AABD coverage and, sort of why this question matters. Because it can kind of be this question, it can be important depending on the circumstance. So people with Social Security Disability Insurance, SSDI, can get Medicare coverage 24 months after their disability start date. And what that means is there is a population of disabled adults under 65 without Medicare who are still eligible to be getting AABD and ACA. They qualify for both programs. So they kind of have this opportunity to pick, which is why that question pops up. If you're working with someone in this circumstance, they've been approved for SSDI, but they are not receiving Medicare yet, you do want to make sure that we recommend that you have them apply for ACA Medicaid. And that's because it's a much easier program to get into and it's a lot simpler of an application. So to help you remember that, we did create this little chart. It's intended as a reference chart that you could put near your desk or something like that. It is included in your toolkit just to kind of, again, help when you come to this question, you're not sure what to do, you can glance at this and use this to help you remember. All right. After you ask that question, it will ask you questions about if the applicant is filing taxes. Don't worry about getting tripped up about like if it's this year or like the year that they're filing taxes. This question is really mainly to figure out if they're a tax filer. And that's because rules for how households are counted can sometimes vary depending on if the person files taxes. Again, I do recommend you look at that flow chart that we attach, which will kind of help you understand how it differs. But again, as far as we're ever aware, this is the only reason why they're really asking this question. It's to sort of figure out, are there dependents that you file on your taxes that you need to include on the application? Do you not file taxes? It's just for that purpose. Next, you're going to list the Social Security number. When you type it in, it will come as little black dots. You won't be able to see it. So I always like to try and write the social down on a whiteboard because I can erase it really quickly and I have the social right in front of me. And so I'm not like, going back and forth between different screens because you don't want to mistakenly type this in wrong. I did that by accident. It causes a lot of problems. Be careful. So just go ahead and put in the social for the person who's applying. Again, if you are listing information for a household member who just, is part of the household but does not want to apply for Medicaid, you can skip over this question. And you can tell that because, it's not required. There's no little red star. All right. Now right here, if the person has had their green card for more than 5 years, you can enter in their information that would be on the green card, or if they're a U.S. citizen, you'll put in their information here. If you are applying for emergency medical for a non-citizen, click yes here. Okay, you need to click that button. Then if you're listing the green card information, this is where you're going to put that on there. These questions do pertain to information on both the front and back of the green card. So if you're working from a copy, make sure you request both sides. Next, we're going to get questions about veteran information. That's pretty cut and dry, just yes or no. And we have some optional race and ethnicity information. It's collected to get demographics about exactly who is applying and receiving public benefits, but it's an optional question that the applicant does not need to answer if they don't want to. All right. Following that, it will ask you if the applicant is, where they're living. Beginning application assisters should always be helping people who are living in this home. If you are working with someone who is living in any of these other places listed on the drop-down menu, we do recommend that you either reach out to advisory just to, ask about that specific situation, or work with a more experienced counselor, because there will be specific rules pertaining to a person living in one of these situations. The next question is going to ask if your applicant is blind or disabled. It is worth noting that this is really referring to if they have been approved for disability by the Social Security Administration. It is a little misleading, because if you read the question closely, it'll say Social Security Administration or a disabling condition, at least 12 months that prevents a person from working. It's worth noting that this definition right here is Social Security's definition of disability. And so they're really asking if the person has been determined disabled according to Social Security's rules. And unless the person has railroad retirement disability, which is similar but different, they're not really going to be considering them disabled unless they've been approved by the Social Security Administration. So, it's not whether or not the client identifies as disabled, it's whether or not they've received an official disability determination for them to kind of consider, you guys get my point, for you to be considered disabled. The next question right here is going to ask about if your applicant is receiving services from the Department on Aging's Community Care Program. That is a caretaking service that's facilitated by the Department of Aging. And people who are receiving this usually have a home and community-based service waiver. If your applicant is disabled, they're going to ask you some questions about the person's disability. I'm going to go to the next slide because it shows it in more detail. It's going to ask you right here, like if the applicant, if the Social Security Administration has made an official determination that they have a disability. This question's not you don't have to worry about it too much. It's just sort of relating to the Social Security application process. And, again, you're going to really only want to list them as disabled if the answer to this is yes. The exception being if they have railroad retirement disability, in which case you would list it, probably in the notes. All right. If there are additional household members, you will click Add Person, and then they will run through all of these questions for all of the other household members that you're listing. All right. With that in mind, I'm going to pass this over to Haley, and she's going to review identity proofing.
Okay. All right, so at this point in the application, it will prompt you to verify the applicant's identity. So it'll ask if they have an Illinois driver's license or state ID card. If they do have one and you have it in front of you, I would select yes. If not, you can select no. So if you do selected yes to the client having an ID, you will be prompted to input their information. So you will need to type in the information exactly as it states on the ID. So this is down to every detail. Like for example, if there is a 0 in front of the 5, when it states the person's height, that will need to be entered. Any missing space, any missing number, initial, or letter will result in the system being unable to verify their identity. So if the person does not have an ID present, you'll be asked to answer a series of questions that come from their credit report. So these questions can be very specific and sometimes a little awkward to ask because of how specific they can be. So some examples is what their previous telephone number is, what year they took out a mortgage loan. So it's important to note that this option is only available if the person has a credit history. So if you were unsuccessful in answering the verification questions, or if there's no credit history, then the applicant would need to contact the company Experian or submit a form to DHS. There's more details on alternative methods in the HFS management case guide that we included in your toolkit. So after identity proofing, the next section you'll encounter relates to the health coverage, disability, and unpaid medical bills. So if the applicant requested backdated medical coverage, then you'll need to answer these questions. So who lived with you during that month, who lived in a hospital or away from home, and who has unpaid medical expenses. So next, the application will ask if anyone has received a service under the developmental disabilities waiver and has not received benefits yet. So this waiver is an HCBS waiver that we discussed earlier. The next question will ask if anyone has health insurance through their job. So they're asking this to learn whether or not Medicaid will be a primary or secondary payer. And we also need to note that they must accept employer health insurance if it is offered to them if they're applying for Medicaid. Okay, so on this slide, we'll just define what it means to be a primary or secondary payer. So Medicaid is a payer of last resort. So this means that if the applicant has other insurance, Medicaid will only pay what that primary insurance does not cover. So the employer health insurance would be the primary payer, then Medicaid would be the secondary. Medicaid will never pay first because they are the payer of last resort. And it's in this section that they will ask for the type of coverage, but the other information, such as like the name of the company or policy holder, is not required for the application.
Okay, so I'm going to move on to talking about the asset section, which is the next section in the ABE. All right, so as a reminder, ACA Medicaid does not have an asset test. And so these questions are really only going to pertain to somebody who is applying for AABD Medicaid. You'll still, for someone applying for ACA, they will still get asked the questions, but they're not going to be relevant to the case. Additionally, there are a lot of exceptions to the asset rules. There are a lot of different assets that are exempt, and we're going to cover how that works in this next section. So the first page is about liquid resources, which is basically what that means is it's in, any money that would be in any kind of bank account. And this is the page that's sort of referring to the assets that are calculated towards the asset limit. So for AABD, there is a $17,500 asset limit, and it's the total of any kind of really bank account that the person has. So you would need to list the value of any cash the person has on home, the value of their savings account and their checking account, and then any other kinds of accounts that they might have. This little, pop-up box that comes up when you click the question mark kind of gives you an example of other types of accounts that would count towards the asset limit. The most common one that we encounter would be IRAs or retirement accounts. But there's a variety of different types that they would consider. The other thing we want to draw attention to is there is this question that pops up that asks about other liquid resources, and it's specifically asking if anyone has sold or given away a liquid resource in the past 5 years. And they're asking that for a specific reason, and it relates to applications for home and community-based services and long-term care. So anybody who is wanting to get HBS services or long-term care is going to have a 5-year look-back period where they're going to be looking back to see that they met that asset limit in the past 60 months. And that's because they don't want people to be giving away or transferring assets to meet that test. However, it's important to note that regular AABD Medicaid does not have an asset test. It's just for HCBS services and long-term care. And so if you're doing an ACA application or just a standard AABD, you will need to answer this question, but it will not affect their eligibility. All right. Again, here's just another list of different types of liquid resources, and the total value must be under the asset limit. And then, yeah, this is what it looks like where they're asking the balance of the accounts. because they're screening for eligibility for past months. If you require past, your backdated coverage, they're going to ask the balance of the account for that month as well. And once you list liquid resources, it's going to ask about vehicles. For AABD, you are allowed one vehicle per person, or one vehicle per person is exempt from the asset test. And so most of the time, any vehicle someone has would be exempt. If the vehicles is exempt, you don't need to list like the fair market value or any of this information because they're not going to require it. They're only going to ask for all of these details if they have a second, like an extra vehicle that's going to get counted towards the asset test. So what I usually do is I usually just list like the most basic information and then I go ahead and move on because I know I don't think I've ever had a case where they have a vehicle that isn't exempt. The next question they have is real estate. So the house the applicant lives in is exempt from asset tests. If they own a separate home, or, or like a second, piece of real estate, that would not be exempt. So if the client does live in these homes, you can go ahead and skip the questions asking about the fair market value and the amount owed because that asset is exempt from the test. I would recommend sort of paying attention to these questions here, though. They do relate to eligibility for HCBS services and some various programs, and so you do want to kind of note them. The most important would be if the spouse is living in their home and particularly if there's an applicant who's living in like a nursing care facility or excuse me, nursing home. So these ones, just make sure that you're paying attention to them, I'd say. The rest are pretty cut and dry. You're just verifying the address, and then just sort of general information, and you can more or less skip over this because it's 9 times out of 10 an exempt asset. One thing to note though, we really want to make sure that it's important that you communicate this to clients, and that people are aware of it, is estate recovery. So legally, the state of Illinois can recover any money that they spent on someone who had ABD Medicaid after that beneficiary passes away. And what that means is they can put a lien on someone's home and estate to recover the money that they spent. They don't publish how often they do this, so there's not a ton of information that we can give about when and how it happens. But we can conclude that it's usually done for people in long-term care because that is by far the most expensive service. If you want to get more information about this, you can click this link right here. But we do want to make sure that this is a real thing. They do legally have the right to do it. We don't think they do it very often, but we don't know because they don't publish that information. And so you do want to make sure that you're talking about this with someone who owns their home, particularly if they intend to pass on that asset to a family member after they pass away. Important things to note about estate recovery is they will never do it while the beneficiary is alive, and they will never do it while their spouse is living in the home. There are also some other more specific situations where they will never go after the estate that you can look into. After they review real estate, they ask about life insurance. This is something where if someone has life insurance, you are going to want to get a copy of the life insurance policy because they're going to want to get this information. The most important thing is life insurance policies without a cash value are exempt. But if the policy does have a cash value, only the first $1,500 is exempt, and then the rest is counted towards the asset limit. And so that's kind of why they want to look at the policy, just to make sure. They need to figure out the details of exactly what kind of policy this is and all of that kind of information. So you do need to put this information in for that reason. After that, they're going to ask you about other additional resources. As you can see, these are sort of like highly unusual resources. They are asking about if somebody has oil patents. It is highly unusual. You're going to have someone who's going to have one of these resources on the list. I would say if you do, you're going to want to contact an experienced counselor. But again, this is not something I would really anticipate that anyone would encounter. Okay. And with that in mind, Haley's going to go ahead and cover income.
Alrighty. Thank you. So first, they'll request information for any job income that the applicant receives. So you would check off the household members who are currently employed or who have been employed in the last 3 months. In the next box here, you'll answer similarly for anyone who has self-employment income. The application will request details on the employer, how frequently the household member is paid, and how much they are paid. So if they are paid hourly, you select yes and enter their rate of pay and how many hours they typically work. Next, you would select yes or no if they receive other pay like a bonus, commission, or tips. Then select whether the job has ended. Most people will come to you when they have recently become employed, so just iterate to them that if they are approved and they begin working again, then they must report their new job to DHS. Next, if it applies, to enter the income that they received for any month that they've requested backdated coverage. Okay, here are similar questions for people who are self-employed or contracted. You'll enter the type of work they do, when they became self-employed, how many hours a month they work, and what their gross monthly income typically is. Okay, so tips for reporting self-employment. Fill out as much information as you can, but don't put down anything that is untrue, of course. It's important to know that you can list expenses, and these expenses can be deducted from that person's gross income. So for some clients, like every bit can make the difference when considering eligibility. So you would want to encourage them to report any expenses that they can deduct. And if needed, the client can also use and submit ledgers to help them document the expenses. Okay. So other income. So you'll first be asked to report any income received from SSI, and then in the next box, enter any income received from retirement, survivors, or disability insurance. Okay, so these benefits are all different. They are all Social Security income programs, but they do differ in a lot of different ways. So it's important to know which income the client receives and to enter the income into the correct box. It's also possible to receive multiple Social Security benefits at the same time. And if you're unsure what the difference between these programs are, I would highly recommend looking at our references. Okay, if you entered yes to receiving other income, you need to state when payments started, how often, and how much payments are. And then back to Kelsey.
So once we've gone through the income section, we're going to go over additional information. All right, so this is what it is. It's a box where you can add any kind of additional information that you may not have otherwise been able to communicate throughout the application. So this comment section is actually really important because it's kind of your golden opportunity to highlight any important component of a case that might be easy for a caseworker to overlook, because you have to remember humans are looking at this and we're all able of making just like oversights and things. And so sometimes something you might put in a bubble, people might miss it, right? So you're going to highlight anything that's important or in an unusual situation on the application that you otherwise can't communicate in the rest of these questions. The language in this box should always be very brief and professional. It is not a space to tell client stories. But what you should do is also provide as much supporting documentation as possible for whatever the situation might be. So with that in mind, we sort of sat down and thought of some circumstances where we commonly found us putting something in this comment box. And then we kind of walked through what we would say in that circumstance. So if a job ended, I would clarify that in the comment box, particularly if someone has like one more paycheck coming, because I would want the caseworker to understand very clearly that although there maybe is one future paycheck, it's going to stop. All right. So I would put down this job ended, the date the job ended. And then if someone's getting like paid out in PTO or sick time or something like that, I would also note that like any future income is from PTO just to avoid potential confusion. If someone is potentially eligible for spend down, it's really important that you note this is a spend down application in this box, because you can't note it's a spend down application anywhere in the app, like any other part of the ABE. And so if you don't mention that in the comments, they are likely not going to evaluate the application for spend down. They'll just be doing it for like typical AABD. I also, if I'm requesting backdated coverage just for good measure, I put a little note that says this has backdated coverage for the months. If there's a medical emergency, can't guarantee that this will expedite it, but it certainly can't hurt. I always ask them to expedite due to a medical emergency with a very brief description of the diagnosis. And I put that in the comments as well, so they sort of see and understand the situation and they know what's going on. If it's emergency Medicaid for undocumented immigrants, I would also, put that in the notes just like this. And then, there's other weird circumstances that pop up. So, this kind of gives you a format for how you should maybe write and draft your comments. But yeah, any other unusual circumstance, just try your best to have a brief note that's informing the caseworker of what that is. All right, so submission. We've now filled out all of the information on our ABE application, and we're going to go ahead and get ready to submit. So they're going to show a screen that reviews the person's rights and responsibilities that you're going to want to go through with the client. And then you're going to check this box right here. It's clarifying that everything that you said is basically true and correct. Same thing with this section when you sign it. I do always take this time to review with the client that the Department of Human Services, they have their social. They're going to be using their social to double check all of the information that they've given, particularly income information. It does not happen often, but I have had a couple cases where there's like maybe an extra job or like some extra source of income that they haven't disclosed to me. And so I always make it clear, like if there's something extra, like Department of Human Service will know about it. They will be able to see it. And so, all of the information I've given you is just kind of based off of what this person's told me. So I always review that with them, and then I type the person's name right here. And that's the same thing as like a legal signature. Then it's going to show you the screen right here, and it's going to tell you the specific office that the application is going to go to. The system automatically is going to route the application to the nearest office. However, if the person doesn't want their application to go to the closest office, you can always select for the application to go to a different one right here. One thing to note, I regularly like to try these numbers just to see if it changes, but this is not going to connect someone who it works at the specific local office. The office number is just going to route to the IDHS hotline, which is a good way to reach a caseworker, but it's not a good way to reach someone who works specifically at that office. Okay, so after you, hold on. Yep. So then you're going to go ahead, you click the submit, it sends off. And once it's been sent, they show you this tracking number right here. This is important to save. It can be important to locate an application. On a rare occasion, they sometimes get lost. And so you do really want to make sure you have this tracking number because it can help a caseworker find the application. You can also print a copy of the PDF. You just click this, it'll pop up, and then you can save it to your desktop. Then you'll have next steps which is important. You're going to want to click that because once you do, it's going to take you to a place where you can get to some document submission. So make sure to click next, and then you can upload any type of corresponding proof that you'll need that you'll need for the application. So it shows you this list of different types of proof. You'll go through it. Some people misconstrue this as a list of required documents. It's not. It's just a list of the different types of documents a person could submit. So go through and you'll click, the ones that you have, and I'm going to review what you'll need to submit and when in a moment. When you get to documents, you're just going to list the person's name, the type of proof, and the type of document, and then you'll be able to upload the file. So here's a list of documents that you're always going to want to submit if it applies to the situation. This is included in your toolkit, so I'm not going to spend a ton of time going over it, but just as a note, you will always need to submit these applications or these documents for the application. And if they're not submitted, then the client would likely get denied for not having the appropriate documentation. If the person is applying for AABD, you will always want to submit these. The most important thing to note is you need to include copies of any checking accounts and banking accounts, and it must be a recent bank statement, not an old one. And then these documents are recommended. They're not required, but we encourage them. So the Department of Human Services can see work income from Social Security and Social Security income internally in their system. And so you don't technically need to have pay stubs, most pay stubs, or it's like a Social Security award letter. However, we do recommend you try and get a copy of that for a client because it's very useful to be able to see the exact gross amount when determining eligibility. Same thing for the identification. If the person passes the identity proofing, they don't need the driver's license, a copy of it, but it's useful to have this on hand so that way when you go ahead and you do the identity proofing, it's just easier to be reading off of a copy than what someone's maybe telling you over the phone. All right, with that in mind, we're going to go on to part 3, which is how to manage my case.
All right. So what is Manage My Case? So Manage My Case is a portal that allows you to file redeterminations, apply for new benefit programs, view the status of any existing benefit cases, view important decision notices like by IDHS, and then report changes and upload documents. Okay, so all right, so we did mention Manage My Case briefly in the intro slides. Sorry. Okay, so when would you?
Okay, so the first thing you're going to want to do to access Manage My Case is you're going to go ahead and click this login. You're going to need to log in with the person's username. All right, and then you can click this button right here to check the status review and application of a case that's already been submitted.
All right, and then next you would select to link the account. Okay, in order to link the account, you would need to re-enter the client's date of birth and social security number. If you have the client's individual ID, you would not want to enter it here, even though it does make it look like it's required. It will cause glitches, and so it's best to just leave it blank. Okay, if you have not verified the client's identity yet, which you would have done at the time of application, but you are able to bypass it, you would want to enter it now. Otherwise, it will block you from linking their case. If the client has had multiple cases with IDHS, you will see the option to choose a case to view. Select the case you're currently working on by clicking to report changes. Okay, now that you've selected the case, you'll be brought to the Manage My Case home screen. At the top, you will see the 2 big buttons that you can use to report changes and apply for other benefits. Then below that, you'll see their active and inactive cases. And then when you scroll, you'll also have an option to view the upload history or upload documents to their case. Okay, and then there will also be past notices that you can see, and then a section where you can view the status of any application, redetermination, or change reports that you have pending. Okay, and so next I'll walk you through all the tabs that are at the top of the home screen. So first you have the case summary tab here. This is where you would click to see notices and then view any of those uploads. Next is the benefit details tab, where you can select the benefit program that the client has either active or inactive. There can be helpful information here that you're not able to find in some of the notices you receive. For example, the coverage start dates, when their next redetermination is, what their current coverage is, and you'll also be able to view and print the insurance card from here as well. Okay, the next tab is the contact information. Here you can view what address DHS currently has on file, as well as the address and contact information for their DHS office. It does give you the option to email the office, but we recommend just contacting the LOA to get the most efficient response.
Yeah, I emailed the office one time and I think it took them 6 months to get back to me. So it's an option, but it'll have delays.
Okay, here is the account management tab where you can change the password and view who has access to the account. Okay, so next we're going to discuss redetermination and report change. These are the two features that are available on the management case home screen. So what is a redetermination? Medicaid recipients must go through a redetermination every year in order to renew their Medicaid benefits. You'll often hear it referred to as a RED. So recipients will receive a form in the mail when it's their time to redetermine. And these forms will have pre-populated fields that will require less information than the initial application. Some people will be automatically renewed if DHS can verify their income in their computer system. Also, recipients will be notified if they've been automatically renewed. Okay, so here's a visual we created that shows the two types of redeterminations. So it begins with DHS splitting everyone into two groups. First here is the ex parte or Form A group. So these people are going to be automatically renewed. So they will receive a form titled Form A that notifies them of the status. The second is the Form B group. So these are the people who will receive the redetermination paperwork that will require them to report income and other information about their household. They may also have to provide additional documentation as well. So to note, if someone has both SNAP and Medicaid, they may automatically be determined for Medicaid, but not for SNAP. So these people would receive a Form A for Medicaid, but will still receive a redetermination form for SNAP. And just because they want to make it tricky, the redetermination form for SNAP will say redetermination for Medicaid and SNAP, even though they've already been automatically redetermined for Medicaid. Okay, so then for those who may not know, the period of time between March 2020 and May 2023, we were in what's called a public health emergency due to COVID. During this time, no Medicaid recipients had to complete a redetermination to maintain their Medicaid. So we are now in what's called the Medicaid unwinding. So this means that for those who did not have to complete a redetermination for the past few years will now be completing them, some for the first time. So we just wanted you to be aware of this since you may encounter clients who have not had to complete a redetermination before. Okay, so then completing redeterminations. So Medicaid recipients can complete their redetermination by returning a mailed form, calling the IDHS hotline, or submitting one through management case, which of course we recommend using management case if possible. If the redetermination is not completed by the deadline, the beneficiary will get a 30-day grace period to turn in their redetermination late. After that, the benefits will end. So these 30-day grace periods are a provision of the unwinding. and they're currently scheduled to end in December 2024. Okay, and then here's an example of the button that will appear on the Manage My Case home screen. So you'll be able to see this ready button up to 60 days before it is due. And when you click the button, you'll see this overview that will state what benefit you're redetermining for, as well as the due date. Okay, and then here is a step-by-step guide to the redetermination form. So you would have the form, which is going to be auto-populated to a certain extent. You'll confirm that the information is correct with the client. If it's a spend down case, note that in the comments, and then you would go ahead and submit it, and then upload any required documents if necessary. Redeterminations typically take about 15 minutes to complete. Okay, here's the final screen that states the tracking number for the redetermination. You can save a PDF and then submit any documents. This is where most denials occur because people don't follow up with the necessary documentation. So it's important to be on alert and to check for any verification notices that are posted in Manage My Case or received in the mail within the few weeks after you submit. Okay, so the second button you can select is the Report Changes button. So here is where clients can report changes that may affect their case. So example is like contact info, household members that may have moved in or moved out, changes in expenses, changes in income, and more. So recipients must report changes within the 10 days of the change occurring. So you can track change reports, and you should follow up with DHS if it has been processed in 30 days. The client can also call the DHS hotline to report these changes as well. And then here is a troubleshooting tips. All right, so here you see your session has ended because of an error. So this is a common occurrence, and it can be like a little tricky to fix. So ABE will sometimes glitch mid-application. When this happens, you may be permanently blocked from accessing the application. So in order to get around that, you can try logging in from a different browser. You typically want to avoid using Internet Explorer because it's not very compatible. You can also restart the computer. But if the problem keeps occurring, you can create a new ABE ID. So you make a new username and password in order and link that account. Okay, you also want to avoid hitting the forward and back buttons. You don't want to use the ones in the browser. There's going to be some at the bottom of your screen on the web page that you would want to use instead. All right, and then here's another example. So for some information you enter, you have to wait until you reach the end of the summary. So once you enter all the information for the summary and you get for a section, you get to the summary page, you would want to select change or erase in order to go back and correct, rather than using the back button on the web page to try to get back to that spot and correct it. It'll block you from doing that. You have to wait to the end of the section in order to progress.
Okay, so we want to talk about delayed applications. The Department of Human Services must process Medicaid applications within 60 days of the submission. So note the date that you submit the application, and if it has been pending for more than 60 days, you do want to start following up on the status. Additionally, if the case has been pending for more than 60 days, you should also be able to request a temporary Medicaid card through the client's Manage My Case. You'll just log in and it should be one of the first things you see. That card they can show to their providers and sort of use it in the stead of them processing the application. All right, so here's some different avenues on like following up on an application. It can be tricky sometimes to figure out like who you follow up with and how to do it. So we kind of compiled some information on like contacts that we found that allow us to follow up on these applications. We put this together in a chart. that has the details on like contact information, how to do it, all of that kind of stuff. So I do recommend you sort of take a look at the chart in your toolkit that goes into this in detail. One thing that I do want to know is the Shriver Center has a really great resource called the Help Hub. You can enroll at this website right here. And this is a platform that allows you to connect to other Medicaid application assisters and legal advocates in the field. Our own staff member, Stella, who's on this chat, she answers a lot of questions on Help Hub. You'll probably see her there. The other thing that you can do is you can contact our advisory department for technical assistance. We specialize particularly with like older adults in both Medicaid and Medicare as well. So you can email us here and we can help you with any questions that you have. Okay, this is just sort of me sort of encouraging you to review the toolkits. It includes a copy of this slide deck. HFS put together a really useful Manage My Case guide that does go through how to do Manage My Case with some more detail than we were able to today. That really useful household rules flowchart that I talked to you about earlier, which was developed by the Center for Budget and Policy Priorities. We have citation lists, which can help you do further resource. And then we have these little reference sheets that we made. Again, just sort of infographics that we found would be easy for someone to try to take a look at if they need to just remind themselves about different information really quickly. Another way to learn more is you can sign up for advisory alerts and training. Again, we have a department here. Our advisory department specializes in offering Medicaid and Medicare related trainings to professionals in the field. We also send out alerts that detail policy changes and updates. So if you want to sign up for our alerts, you can go to our website and then you click this contact advisory button at the bottom. There's also advisory has some upcoming trainings that may be useful. There's an intro to Medicaid training that would be a really good complement to this one that we've done today. That training it's more focused on policy, and it gives a really good understanding on like all of the different programs and covered services available in Illinois, along with like a variety of other different topics. We also are going to be having a training on Medicare savings programs. And then in June, we're having a guest speaker come to speak about Medicaid estate recovery and then the prevention of spousal impoverishment, which is a specific Medicaid program. All right. So with that in mind, we've come to our conclusion. We wanted to thank you. And we're going to just take the last few minutes to, see if anybody has any questions. Yeah, and then you can feel free to unmute as well. Don't worry about putting them in the chat. For anybody, again, any questions that pop up, you can also always reach out to us if you have any that come up along the way as well.
Also, we'll be sending out the toolkit and the recording after the webinar.
Okay, well, with that in mind, it sounds like there's no questions, which is great. Yeah, so in that case, we're gonna go ahead and let you go early. Everybody enjoy your day. Thank you for coming. And yeah, hopefully we hope this is helpful and this is a good resource that's available to you to assist with your applications going forward. Thanks so much, everybody.
Thank you.